if you have low iron levels, low ferritin levels, you can actually lack the ability to produce enough dopamine in your brain.
Welcome back to the Rest Report. I'm Natalie Walton, the General Manager of BetterSleep, and today we're talking about nutrition, but more specifically, how iron levels impact our sleep wellness. To help us understand this better, I'm joined by Dr. William Liu. William, it's great to have you on the show.
Hi, Natalie. Thank you so much for having me here. Look forward to speaking with you about iron levels and how it can impact our sleep.
Wonderful. So, before we dive in, could you please share a little bit about your background and your specialization in this area?
Yeah, absolutely. My primary specialty at the base, a primary care family medicine physician. I do have additional board certifications in sleep medicine and in obesity medicine. So I've been caring for patients in these different fields for a number of years. And yeah, I've taken care of a lot of patients with low iron levels and how that specifically can impact sleep.
Let's jump into it. Part of the reason that this conversation is so exciting to me is because I have a deeply personal experience around iron. So I gave birth to my son in 2019. I had a placental abruption where, frankly, I lost a lot of blood. And for the ensuing years, I really struggled with my energy levels. And I saw many doctors. A lot of them said, "Oh, you're a new mom. You're a founder. It's the pandemic." Every excuse in the book. And it got to a point where I was napping every day, really struggling to function as a human. And in 2025, I decided to get a function health blood test. And it showed that my ferritin levels were 12. That to me, that seems a little bit alarming when I look at the range. But I went to Dr. ChatGPT. I started doing some sleuthing. And ultimately, I decided, I think I probably need to get some iron in my system and get it fast. And so I went to a place locally where I was able to get two iron IV transfusions over the span of a couple of weeks. It took my iron from 12 or my ferritin levels from 12 to I think 120, 130. And I swear, I'm 40 years old. I felt like a 25-year-old. Um, Now, this is really open ended, but I would love for you as a doctor, from your perspective, someone who specializes in this, to help me understand like what was happening. And yeah, I mean, what was happening with me, and is this a common thing?
Yeah, first like I'm sorry to hear about your experience. It's it's always really tough when you're like I'm feeling this sort of way, and everyone's like, oh, it's your new child, or it's factors maybe outside of your control, right? But I just want to kind of identify a few things that happened there, which is you had a pretty significant amount of blood loss during that pregnancy, right, with that placental abruption. Um, and generally the first things that come after a pregnancy is really checking to make sure that your iron levels, your hemoglobin, which is your red blood cells that carry the oxygen around in your body, are coming up kind of appropriately, right? And um I think that uh, that's one thing that should really always be checked. Kind of after a pregnancy, especially after there's been a lot of bleeding after the pregnancy. Um, but I'm really happy that you were able to eventually catch this right through Function Health to really kind of catch that ferritin level, which is the iron stores in your body, was really low. And I frequently find that many patients actually do not know that their iron stores are low. And we know that the reason for this can be because of blood loss, for various reasons. It can be from post pregnancy. We even know that from menstrual cycles as well, too. That is something that blood loss can really kind of lead to really kind of more low iron levels. Um, so, what was really kind of happening is that if those iron levels were not there, your body wasn't, it wasn't producing the red blood cells, sufficient red blood cells to carry the oxygen around in your body, and so that's probably what led you to feel more tired. Why you felt like you had to nap. Um, The other kind of aspect that I see, a lot, from the sleep aspect is that if you have low iron levels, low ferritin levels, you can actually lack the ability to produce enough dopamine in your brain. And this can actually lead to more interrupted sleep, inability to fall asleep kind of at appropriate times, and can lead to really kind of more disjointed sleep throughout the night.
That's so fascinating. Can you help me understand how iron deficiency fits into restless leg syndrome? And also, what is restless leg syndrome in case people don't know what it is?
Yeah, I think it's good to even just understand like what restless leg syndrome is. So it's really what we call a clinical diagnosis. So there's really no tests for it, right? Like the only way that we can diagnose restless leg syndrome is actually asking patients about their symptoms. Um, Now, this might sound like something out of like a Halloween show, or in terms of symptoms, but how patients generally describe symptoms to me is that at night, and generally at night, patients will actually feel symptoms within their legs, right? Uh, those symptoms might be, soreness. It could be feeling like there's spiders crawling up and down their legs, electrical shocks. So, for every single person, it's a unique potential symptom there. And so, what's really causing this? We know that there can be some genetic, kind of predispositions, right? So, if your mother or your father had restless leg syndrome, you may have, a higher risk for developing restless leg syndrome. But we also see that there's a primary association with low ferritin or those iron stores. And so, what's really happening? We know about the dopamine, right? And everybody, I think, when they hear dopamine, they think about that feel good, like a kind of hormone there. If you don't have sufficient amounts of iron, you are not going to be able to produce enough of that dopamine. And the result of it is you can actually develop the symptoms of restless leg syndrome as a result of that.
Wow. So, like, what I'm taking away from you is that iron deficiency, it can lead to so many things. I mean, it can lead to restless leg syndrome. I could lead to, I don't know what I don't know if you could even label what I had, but whatever I had, I knew it was impacting my sleep. How does one know if an iron deficiency is the root cause of their sleep issues?
It's sometimes it's tough to find this out, right? And the only way to really know, what your ferritin and iron levels are at is really doing a blood test. Um, and so a lot of this is really dependent on really patients actually telling their providers about their symptoms. And even then, it's like iron and ferritin are not typically standard blood tests that are ordered across even just your primary care checkups. Um, or just as baseline labs, right? And so sometimes it can be missed, right? And it can be tough to really kind of to catch these symptoms, especially if patients don't have that awareness that it's happening. I've heard patients describe restless leg syndrome as, yeah, I just feel this thing, like happen, kind of when I'm sitting on my couch, but never really kind of thought more about it. We think that restless leg syndrome actually affects anywhere from 1 in 6 to 1 in 20 people in the world. So it's a common disease. Yet there's so little that we're doing to catch this and to help patients with these symptoms.
Wow, that is, I mean, if you don't know, you don't know. And so I think like having conversations like this are so important, because if you can't sleep, it is the worst thing in the world as someone who did not sleep for 5 years. But are there things besides restless leg syndrome? And I guess, I mean, what I experienced, are there any other conditions that an iron deficiency can impact on your overall sleep health?
Yeah, we always know that the low iron is most associated with restless leg kind of syndrome. Um, there's lesser evidence that says that if you just have iron deficiency anemia, how does that impact your sleep? The evidence isn't as strong, but I think that over time we're probably going to find more and more associations that if you have, kind of insufficient iron, even without a restless leg syndrome diagnosis, you may experience, kind of worse quality sleep as well.
Now, something that I find really interesting about restless leg syndrome, and I've kind of experienced this, like some tingling in my legs, particularly during pregnancy. I don't know if it comes up more during pregnancy, but I would always feel this like, I don't know, not an itch, but just a weird feeling like a reflex that I needed to stretch my legs. And it kind of went away after pregnancy. But one thing that I'm curious about is it's kind of like a paradox. It's like many people with iron deficiency, they feel exhausted and they experience restless leg syndrome and they can't sleep. Like, why does having movement in your legs prohibit you, like disrupt your sleep?
Yeah, great question. And to kind of address, it's like I'm not sure, with your pregnancy, but restless leg syndrome is very common in pregnancy. So
Oh,
actually, being pregnant can actually be a risk factor actually to develop symptoms. However, once the baby is born, we expect that symptoms can actually improve or even resolve. So it can show up like maybe in your second or third trimester of pregnancy, and then kind of disappear from there. But I think like what you said is that iron deficiency and restless leg can really kind of show up in so many different ways, right? Like when you're iron deficient, you're going to be tired during the day. Yet when you're trying to sleep at night with restless leg, you might have a much more difficult time falling asleep, right? Imagine laying in your bed. You're already kind of like you're already tucked away there, but you feel this like it's almost like an itch like in your legs that won't go away, right? And so you might lay there for 30, 60, 90 minutes like trying to fall asleep until finally you feel so tired that you're like, okay, I can really achieve that sleep. um, However, that's not the end of it, right? Like if you're waking up in the middle of the night to use the bathroom, or let's just say like eh, restless leg can even be associated with something called periodic limb movements of sleep, so you can actually continue to move your legs while you are sleeping. And so this is really kind of a factor of kind of your brain with the low dopamine levels. You're actually in a kind of a hyperactive state, right? So uh, you're actually kind of in overdrive, and so that's why really the movements are really there. It's almost kind of a symptom of kind of like the low dopamine and the low iron levels.
wow, that is just super fascinating. I want to move us on because one of the things with our podcast is we really always like to go into the fix. Like, how do we help our users that might be experiencing this? And for me, one of my questions is so if someone suspects iron deficiency may be causing their restless leg syndrome, or they're like myself, they've given birth and maybe they're struggling with heavy menstruation and sleep problems. What's the first step that they should take? I mean, I guess even what's the first step that they should take, but also like if there are other lifestyle or nutrition things that they should consider. But, it could be a number of things. So I'm curious what you think.
Yeah, I think these conversations are always really great because I think the first step is just listening to your body, right? I think that, just getting validation that, if you're feeling tired or, that you're finding that you're needing to nap frequently, that if that wasn't the case for you, it's like that something has changed, it's really just identifying that, right? And I think that, um, you know, we know our bodies best, right? And I think that like if we follow that, like that's going to be really kind of the first step to alert us to, is there something potentially kind of awry? Um, the next is like is really trying to find trying to get like the objective data there, right? Like, do you have that low iron level? Is the ferritin really kind of decreased? um, because ultimately, like if it's not right, like then we have to really kind of look elsewhere, right? We have to find like the origin of what's causing those symptoms. um, and so really like making sure that you're established with a primary care provider that is going to listen, that's really going uh, to be able to kind of address those concerns. I think like that's a really kind of important kind of a piece, is just like helping you identify what those symptoms you kind of might be coming from. And if we do find that there is low iron, uh, I do recommend, iron supplementation. It's like we can, there's so many great, kind of good, clean, kind of iron supplements that can be taken kind of on a daily basis. We always want to be a little bit cautious because taking iron can cause symptoms such as constipation or turning the stools dark as well too. So we want to kind of use, we want to use it kind of cautiously here, and to kind of get you to the right place. But once you start to really kind of once you start to supplement that, or even in your case, like the iron, kind of IV infusion, if necessary, we can see that symptoms can start to improve, and that for some patients, the RLS might disappear completely.
I mean, that was my personal experience that really within 3 or 4 weeks, I just started to get a buzz that I was like, "What am I in college again? I can stay up late. I can go on walks. I don't have to take naps." It was really on a personal level for me, and I know that not everyone is the same. It was miraculous. But I'm curious from like your medical perspective, as iron levels begin to recover, what improvements in restless leg syndrome and sleep quality typically show up first?
Yeah, and I think it depends on like what was the iron deficiency causing, right? Was it causing the anemia, for more your daytime symptoms, or was it really causing more of those like restless leg, kind of nighttime symptoms, or maybe both, right? Um, Once your iron really starts to kind of improve, um, and you know let's just say like your red blood cell count starts to go back up again, maybe the dopamine production starts to really kind of occur again, kind of within the brain. We should anticipate to see that the symptoms get lighter, right? That you might have more energy during the daytime, that you stop feeling those symptoms in your legs, and it becomes easier to fall asleep kind of at night. You might notice that you might wake up with a little bit more energy, or that you felt more well rested as well too. So it's usually not overnight that you'll see like a disappearance of symptoms, but you'll probably see a gradual improvement, maybe even similar to yourself, in which um, over weeks to months that you start to see that gradual improvement.
Yes, I mean, that was what I experienced, and that's why I'm just such a fan, and I encourage everyone, if they're struggling, to get tested, get that information, because there's hope. There's something on the other side of that, and if you've been struggling for years, that's all that you want is hope. This is not a permanent situation. But finally, I would love your perspective on how Better Sleep, our app Better Sleep, can help someone cope with restless leg syndrome, or someone who's struggling with anemia, with these wake ups in the middle of the night or needing to nap. Like, how can Better Sleep help improve sleep quality during this recovery period?
One thing that is so kind of mysterious to patients is, we don't really know when we're falling asleep. We don't know how long we're sleeping for. And so, some of the features with Better Sleep, with sleep tracking, and just like seeing like, how long does it take you to fall asleep, right? If you're laying in bed, and you're listening to, you're relaxing, kind of sounds, or the storytelling, and you're like, yeah, I'm doing this for an hour or 2 hours. I think that's like, kind of maybe your signal to say, okay, like something might be, off here, right? For whatever reason. And so just having more kind of objective measures, I think, can be very powerful, um, and can really kind of give validation, to your users, of what might be happening, kind of before and during their sleep.
Yes, that is my hope. My hope is that we can educate our users and helping understand what's going on, and then getting them having conversations like this to direct them to the help that they need. So this conversation has been so valuable for me as someone who's struggled with the exact thing that you treat. Thank you for helping our audience understand how iron affects their sleep. What's the best way for people to find you or access resources on this topic?
Yeah, I'm currently at a telehealth, kind of sleep clinic called Dreem Health, DREEM. We do take care of patients across the country in all 50 states. Um, ranging from sleep apnea to restless leg syndrome to insomnia. And so we really want to take care of patients in all aspects of sleep. And, because I think that whole care is so important. Sleep is just so important to our health. If people out there are looking for more resources in regards to restless leg syndrome in itself, you could check out the www.rls.org website. This is the Restless Leg kind of a foundation here, and so they're a nonprofit group that's looking to advocate more for people with RLS and to really kind of get the word out there that this exists, right? And many people might have these symptoms, and so I hope that if you are out there and you're experiencing these symptoms or you can relate to this, seek help. I think that better sleep is really kind of around the corner, and there's going to be a lot of ways that we can help to address that.
Well, thank you so much. And to our audience, thank you for watching the Rest Report. If sleep has been a struggle for you, there is real hope. These challenges that you're facing are surmountable with the right guidance. Subscribe to our podcast and the newsletter for the latest resources and follow Better Sleep on our socials. You can visit us at bettersleep.com for simple, soothing content to help you rest. See you in the next episode. Thank you so much, William.
Thank you so much, Natalie.